Sorry to keep you waiting there. How are you doing? Okay. Well, welcome to my Harley Street clinic. So we've got you booked in for a thorough arthritis and joint mobility assessment. Okay, so I'm assuming you're aware of my work in this field. Okay, so I'm going to be very thorough. We're going to be going through a few different areas, asking you some questions, and getting really hands-on with trying to help you today. Okay, just double check I've got the correct patient form. Could you just confirm your surname? Perfect. And your date of birth? Perfect. And then emergency contact name and number if you don't mind. Okay. Yeah. Perfect. Okay. Right then, I'm just going to ask a few questions to begin with, okay? So, when did the pain start? Okay, and where is the pain that you're experiencing? Okay, a little bit on your neck. And your fingers, okay. Both hands. Okay. And is the pain worse in the morning, or is it consistent throughout the day? Worse in the morning. Okay. And do you know if you have a family history of arthritis? Okay. And are you taking any medication at the moment? Any painkillers? Alright. Perfect. So what I'm going to do is just pop some gloves on, and I'm going to come and start the assessment with you, okay? Alright. So I'm going to begin the assessment with a visual inspection first, okay? So no need to do anything, just relax, alright? just looking at how you naturally hold your joints, how it's naturally sitting on the neck. Just going to pop some gloves on now. I'm going to begin a palpation exam. What I'm doing is just feeling for any swelling or any sort of malformation of the ligaments and bones. Just checking the back of the neck. Also just feeling for warmth, which is a sign of inflammation, just where you've said that you're in pain. Do you want to point to where the pain is right now? Just here. Okay. Just comparing to the side. Okay, there is a little bit of calcium build-up on the top of your spinal cord. This is just going to suggest that on your neck in particular, there's been some sort of injury. The body has repaired it by building it up with the calcium deposits. I don't think this is arthritis on the neck. Okay. Let's have a look at your hands. Okay. Yeah. Some swelling, some redness. If you could just hold them out in front of you, don't move them at this point. So from the visual inspection, the fingers do look like arthritis. Okay, how old are you? Okay. It is very common and it's nothing to worry about, it's all treatable. Okay. I'm going to continue. I'm just going to look at your knees and your toes, okay? I'm just going to have a look at your toes. No pain in the toes? Okay, that's good. What I'm going to do now is, I might be a little bit uncomfortable. I'll be as gentle as I can. I'm going to now just move your neck, okay? I'm going to ask you to fully relax, leave the weight on my hand and allow me to move. So let me just get the right grip on your face. Does that feel okay? There you go. Nice and loose for me, okay. I'm just going to ask you to tip your head, or I'm going to tip your head all the way back. There we go. Alright, a little bit shaky. We're going to go down. Alright. Is that one a little bit better? Let's go this way. How's that? Yeah. And let's go this way. Bit painful there. And then we're going to go back. Just looking at me. Perfect. So, I can tell you are suffering a little bit with the pain. So I'm going to suggest that we give you some pain relief injections, and these will last up to 3 months. Okay. And that will stop that sort of shaky feeling as you're turning. Alright. Let's work on your shoulders. So if I could just have you just lift them up, okay? I'm just gonna push them. How's that feeling? Is that okay? Relax. And then again up and relax. Okay. I'm just gonna move your arms. Alright, no pain. Right, if you just relax that arm, I'm just going to start with this hand. Right, so I'm going to ask you to put your hand into a claw shape. There, that's the pain, isn't it? Okay. Alright. Just straighten them out, just taking a little look. Alright, I'm just going to move each finger. Okay, movement is still quite good. There's still full movement. And then wrist. Okay, that's good. Let's have a look at your other hand. Okay. If you could do the claw. Okay, I'm just going to move each finger. Okay, really good. So it doesn't look like the arthritis has done any damage, okay? At this point it's just inflammation, and this is a really good point for us to have identified it for you, okay? Alright. Okay, I'm just going to have you just okay, it's good movement, Alright. I'm going to now just ask you to do a range of movements. I'm just going to be analysing how you move your body. Alright, so if I could just have you looking up and down. And I'm just going to be rating these movements from 0 to 5. So let's go left to right, please. And then in a circle. And then the other way. And then shrugging the shoulders. And then just walking the arms. Okay, perfect. And then I'm going to ask you to make a fist with your hand. And then the other. Perfect. Alright, and I'm going to ask you to just take a couple of steps forward. And then a couple of steps back. Alright, so you have scored really high in the functional movement test. All of this is basically just meaning that we can do some preventative work. Alright, so this is good news. Okay. Right, I'm going to just look at your hands now in a little more detail. So if you could just rest it in mine, that's great. So I'm just going to squeeze the actual joints. Can you feel that? Okay. I think we'll have to order for an x-ray, okay? Just that top joint on your middle finger. It's a little, feels like a nodule. Again, nothing to worry about, but yeah, definitely want to see where that's coming from. Perfect, just relaxing that hand. This one, that's great. Little bit of pain there. Okay. Just just relaxing the hands. So I'm going to order you an X-ray, and that will show up anything that we can't see under the skin. What I'm going to do is I'm just going to do an overall palpation pain assessment, and I want you to just tell me if you're feeling pain anywhere else. Okay. So I'm going to go over the whole body, including areas where you might be a bit confused, like the head and the abdomen, but it's just really good for me to rule out anything else. Okay. I'm just going to touch your tummy. So, because we are a private clinic, we are able to take you straight through to have an x-ray. And then once we've done all of the x-rays, we're going to do a comprehensive full body. My colleague's just waiting in the x-ray room for you, and I'll be with you as well. Once we've done that, we'll take you through and we'll give you some pain relief, do some injections. In terms of your fingers, we can do injections again, but because of the anatomy of the hand, you may be better off taking some medication for the pain, and then we'll give you some anti-inflammatory injections. Do you have any questions? The cost. So you are a new patient? Okay. Well, it's probably something we should discuss at the end. You've been given a ballpark figure. Yeah, perfectly. So we do have payment plans. That'll make it easier for you. Okay. But honestly, don't worry, okay?